Tell us what the Treatment and Implant Coordinator course is about.
The course is broken into 2 sections, and the first part of the day is focused on treatment coordination, looking at the systems behind the role, the free consultation or complementary consultation appointment that the TCOs deliver for patients that are interested in implants. And then we look at the different appointments they can hold around that and how they can support dentists with treatment planning, with the presentation of the options, and we also discuss personality profiling, unique selling points for practices, and lastly, last thing in the day, following up with patients, handling objections, and how to have really successful tracking in practice as well.
So the middle part of the day is me. So I'm Leanna and I talk about implant coordination, and it's how to utilise a person within your practice to best suit implant treatment and follow that patient right from the beginning of the assessment right the way through to the final review. So they're responsible for all of the patients in the practice that are having implant treatment.
Brilliant. Who would you say this course is ideal for?
I would say it's ideal for dental nurses, practice owners, dentists that are looking to make changes within their practice, and there's some really beneficial changes and you get some great tips from the day.
Yeah, and also experienced treatment coordinators really benefit from the day.
Excellent. Is there a common area for improvement in the practice that you feel that you usually see on this course?
I think the biggest thing for Leanna and I when we're teaching this course and when I'm working in practices is systems, isn't it? It's all about systems, and that's what we share in bucket loads for treatment coordination, and your implant coordination section is just jam-packed of systems, whether it's about consent or whether it's about setups and organisation and paperwork. It's the main thing that's missing in practices is the systems that drive the roles.
Okay. So an implant coordinator has attended your course and wants to implement what they've learned. Are there 3 steps that you would say they should take away from the course and implement?
Yeah, definitely. First of all, you need to go back to your practice with a plan. So arrange everything that you want to implement. The next step would be to arrange a meeting with the dentist or practice owner and express why you want to make those changes and what changes you want to make. And thirdly, I would say that you need to hold a practice meeting once you've arranged the changes you want to make and sort of lay it all out on the table to the team so everybody's in the know of what the role consists of and why it will benefit the practice.
Okay. And would you say a culture change is necessary in the practice and how it's run, or how best can they convey what they've learned when they go back to practice?
Yeah, like Leanna said, it's about going back to practice and not going in and going crazy and telling everyone in drips and drabs, I've learned this, I'm going to do this, I'm going to do that, because that just upsets the apple cart. Sometimes in practice it is a culture change of slowing things down to enhance the patient experience and really appreciating that in able to give a better patient experience to support these implant patients, we do need to slow down, we need to change many different systems. It could be the way we book appointments, it could be the way we offer appointments. Culture changes sometimes can need to take place, particularly in practices where the role is completely new and nobody knows about it. But really it's the communication from the top, and the planning and execution of everything that's imperative to making it successful. And the other thing I think I'd like to add in that's really important is that treatment coordinators should be recruited within the practice, shouldn't they? It's really nice. You don't want to cherry pick people. Let's recruit, advertise internally and interview people so we know we've got everyone really on board with those culture changes that we want to make.
Laura, if people want to keep in touch with you after this course, how can they best go about that?
Well, social media, Instagram, Facebook, Twitter, LinkedIn, I'm on all of those. And the best thing to do really after the course, if anyone has any questions, is to submit them to our podcast webpage. So we do monthly podcasts where we answer people's questions. It's all anonymous, so we don't read out, it's Sarah from Straumann's got this question. So we don't reveal any details, and any questions that you have, we answer, give our opinions, and it's a great way to get free advice from us after the course.
Okay. So if all that is discussed in the course is well implemented, what do you think would be the future of their practice?
Well, it's quite a big question in itself, isn't it? Because there's so much that we go through in the day, they've definitely got to prioritise which elements they're going to implement when. And they might actually create a plan that takes 9 months, a year to actually put into place in the practice. But really, what's it going to do to the practice? Well, it's just going to explode the patient's experience. It's really going to support the dentist, treatment planning, consent, all the medical legal issues that dentists are concerned about. This role really supports. So hopefully it should reduce a lot of stress from the clinicians, which in turn is going to give us happier dentists, happier staff, happier practice. But really, I would say the role sits in the centre and supports everyone around it. And that's how it makes it really successful and implements massive change, because it does affect everybody in the practice, but only for positive reasons.
Yeah.
Leanna, what would you say is the main takeaway from this course?
I think there's lots to take away, but it's really, as Laura said, to make a better, smooth running, seamless process for the patient point of view and for the practice themselves and the team. So if you've got one person organising treatment for an implant for a patient, that they know all of the steps are being ticked and everything's smooth running for the patient itself and for the dentist, so they're not stressed, and for the dental nurses as well. You know, they're always sort of overlooked, and it can be stressful when you're in surgery and things aren't booked correctly or not enough time, so it makes it a lot nicer for them as well.
And finally, we've got the next course obviously running in October with you here. Why would you say people should register for the course?
Well, anyone who's looking to expand their role or to implement the treatment coordinator role into their practice needs to come on this course. If you're in implant dentistry, there is no other course like it. This course is completely bespoke to the ITI with the treatment coordination and implant coordination elements. There is honestly nothing else like it out there. So we've had people travel from so far in the past. We've even had someone come from Japan, from what I remember. No pressure on me that day. But you know, people come from all over. You know, just this morning, people have flown in. People have flown in last night, and the reason they're coming, so you know, flying in and travelling far, is because there is no other course like it. So really do look at all the aims and objectives of the course as a really comprehensive list, because there's so much. There's definitely something for everyone, and ultimately, the practices that get the best out of the day are the ones that come with the owner, with the manager, with the potential TCO, with the potential ICO, and they really get a lot out of it. They're the ones that move forward fastest, but it's a great course no matter what level you're at, whether your practice is new to implants, whether you've been doing implants for 10 years and your dentist even teaches implants, you're going to get loads out of it.
Fantastic, thank you.